When toddlers are inattentive, hyper-focused on certain topics or items, and or extremely hyperactive, both professionals and parents wonder if it's normal, if it's just a phase, or if it's ADHD or autism. Today, I want to discuss the differences between autism and ADHD symptoms in very young children and the treatment for both. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, online course creator, and best-selling author of The Verbal Behavior Approach, which has already sold over 50,000 copies and is available in several languages. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Back in the late 1990s, when my son Lucas was 2, he was very impulsive and inattentive and very darty when we were out in the community or out in the yard. He also was diagnosed with a speech delay and saw a speech therapist weekly and attended toddler preschool 2 mornings a week without too many issues. At that point, I was hoping that Lucas's issues were related to just a speech delay or at the worst, just ADHD. I thought autism was a death sentence with no hope for improvement, let alone recovery. I did a blog on recovery from autism in the past, so if you haven't seen that, you may want to check that out now. After 2 decades in the autism world, I know that recovery from autism is possible, and I've also been a part of preventing autism too, but acting at the very first signs of any delay when your child or client is very young is key. As you may know, Lucas was diagnosed with moderate to severe autism 1 day before he was 3, after I was in denial for over a year. Over the past 20 years, I've learned that there is a huge overlap between early signs of autism, ADHD, speech delays, and mental health issues like OCD and ODD. And many professionals, including me, now believe that ADHD may be on the edge of the autism spectrum. In fact, the early signs and symptoms of both autism and ADHD, as well as developmental delays, overlap a lot. Typically, developing kids have lots of tantrums too, and many toddlers and preschoolers who have language or other delays early on do catch up either on their own or with just a little early intervention. Even really bright kids with high IQs without delays often have sensory and social differences, so it is no wonder that everyone is confused. Some signs of autism and ADHD in toddlers are nearly identical, including inattention, not being able to sit and have a book read to him or her, for instance, hyperactivity, being constantly in motion, jumping, climbing, or darting away like Lucas used to do, and impulsivity, refusing to wait, share, or take turns. But these behaviors are also present in most typically developing 2 and 3-year-olds in general, as these young kids are learning abstract language and transitioning to cooperative play. The addition of a speech delay, failure to point by 18 months to show you things, and failure to play at age-appropriate levels is more indicative of autism, but a lot of times it's very difficult to tell. There's also a lot of false reassurance going on in the medical and educational fields with people saying, he's just a boy, my son didn't talk until he was 4, and don't worry, he'll catch up. No matter if you think your toddler is hyperactive, inattentive, having more tantrums than you'd expect, or just seems a little behind in terms of talking, here are the same 3 steps you should take today. Number 1, know what typical milestones are and the ages when your infant, toddler, or preschooler should be babbling, reaching for things, crawling, pointing, putting 2 words together, sitting for a book to be read. The CDC's Act Early website is a helpful resource, and that goes over typical milestones and early warning signs of delays for kids 2 months to 5 years of age. This is number 2, if after checking the milestones, your child seems delayed in any area, make an appointment with your child's pediatrician and get on wait lists for further evaluations. And number 3, learn about ABA, applied behavior analysis, which is behavioral treatment, because even if it's just ADHD or speech delay only, learning these proven strategies will help your child get back on track or improve to some degree. Wherever you're watching this, I would love it if you would leave me a comment, give me a thumbs up, and share this video with others who might benefit. And for a free workshop focusing specifically on how to help toddlers with delays, with or without a diagnosis of autism, go to marybarbera.com/toddler workshop. And I'll see you right here next week.